the inflammation plays certainly a role as a stroke risk factor. The concept has been around in the field for a long number of years, suggesting that inflammatory conditions could lead to, in particular, to atherosclerosis, which is the underground of many of the causes for stroke. So inflammation has been suggested as a disease that is responsible for atherosclerosis and therefore a number of clinical events, including a stroke, but also myocardial infarction. And certainly in the last couple of years, 3 years, we have collected clinical evidence that closes the circle. Now it is not only that we have the idea that atherosclerosis may be an inflammatory condition, but now we know that by administering anti-inflammatory agents, we are reducing the incidence of atherosclerotic related events. Well, so far, we only have primary stroke prevention. That is, as in many other aspects, clinical aspects in the field, cardiologists run a little bit 2-3 steps behind of neurologists, and they have already conducted clinical trials with large number of patients with an admission to the studies. They had myocardial conditions like myocardial infarction, either stable or unstable. But in the primary endpoints of those studies, stroke was also included. So that allowed us to collect, as neurologists, to collect some data on a stroke prevention, but not in the particular case of patients having a stroke and then doing secondary prevention of a stroke. So we have to be careful when reading this data that we are talking about indirect data collected in the stroke in patients with myocardial infarction. Okay, different drugs have been used. Some of them have succeeded, others have failed, indicating that inflammation per se, it is not just what we should modify, but we should also target, particularly what is the mechanism that we can modify pharmacologically. Well, there is ongoing clinical trials with patients with a stroke in which the use of some anti-inflammatory agents, in this case colchicine, is used for secondary stroke prevention. So first step is to wait for the results of this study and see what they show. And if not, show what we expect, then analyze the reasons and try to modify either the design or change of drug. So these are the further steps I've seen in concerning stroke prevention.